The tick disease you must get to know. All about Lyme disease. Hello and welcome to the channel. Round about this time of year, as a GP, my thoughts turn to vaccinations. We are already in flu season in September. Certainly earlier than expected. This time last year, I was still in shorts and t-shirt. But this year, a spate of cold days has disabused us in Switzerland of the notion that summer may stretch on until the end of September. So, we hurriedly check our supplies of flu vaccine. Do we have enough for this most likely prolonged winter season? The answer is no. So we order some more. In my consultations, I'm starting to remind my asthma, emphysema, and other lung disease patients that they will be needing their flu jab soon. The autumn getaway travelers are checking in for their vaccination consultations before they fly off to faraway sun-kissed locations. Another important group of patients who I talk to around this time of year are the hikers and randonnée enthusiasts who love to spend summer days in the woods and forests, as well as those who actually live near woods and forests. These people need to protect themselves from the Tick-Borne encephalitis TBE illness, a viral illness, meaning caused by a virus and not in the sense of famous, which is transmitted by the castor bean tick, whose natural habitat is the thick undergrowth you get in some wooded areas. In Switzerland, the risk of this illness is high everywhere, except in the cantons of Geneva and Ticino. So my area of Bern is high risk. But here's the thing. Whenever I speak to my patients about getting started with a vaccination program for TBE, which is recommended in autumn or winter in preparation for the following summer, when the risk is highest, I invariably get the question, "Oh, is it for Lyme disease?" Believe it or not, this is a trick question. The short answer is no, of course. The vaccine is for TBE. But did you know that the castor bean tick, the little sod, can also transmit Lyme disease, as well as two other bacterial infectious diseases called ehrlichiosis and rickettsiosis, which are rare? So here we have a tick that is multi-talented and non-discriminatory. It'll carry viruses and bacteria. It's an equal opportunities tick. This video is all about Lyme disease. It's one of those diseases that is usually banal, goes unnoticed, until you hit a serious case, which can even happen years after the original event, meaning the original tick bite. The US, along with Europe and Asia, are the commonest hubs of Lyme disease within the areas of deep forestation. Many American celebrities have reportedly been struck down by various forms of Lyme disease or other, notably actors Ben Stiller and Alec Baldwin, singers Avril Lavigne, Shania Twain, Justin Bieber, and model Bella Hadid. As ever, I mention these names only as a reference point, such that the medical topic I discuss in relation to them is relatable and easier to picture, so to speak. Moreover, the information that I have come across in my research has been freely shared by the celebrities themselves, so it is not an invasion of their privacy. Disclosures out of the way, what exactly is Lyme disease, and why is a GP/cardiologist in Switzerland fearful of it? To find out, well, let's not dither. Let's get right into it. Notice I casually mentioned my cardiology background here. There is a reason for this. All will become clear very soon. Lyme disease, otherwise known as borreliosis, is one of the most common vector-borne illnesses, primarily transmitted by ticks, especially the Ixodes genus, also known as black-legged or deer tick. As you would have heard previously, it's also transmitted by the castor bean tick, of course, although that's rather rare. Lyme disease is caused by the bacterium Borrelia burgdorferi and in rare cases by Borrelia mayonnae in North America. First described in 1975 following an outbreak of arthritis in children in the town of Lyme, Connecticut, Lyme disease has become an increasing public health concern, especially in the Northern Hemisphere. So, ladies and gentlemen, at least now you know where the name Lyme comes from. It's the name of a town. This is quite a common theme in medicine. There is a disease which predisposes one to blood clots. A risk factor for this disease is a gene mutation called factor V Leiden. Leiden is a town in the Netherlands where this mutation was first found. You have probably heard about Spanish flu, which was a pandemic in 1918, a little bit like our recent COVID pandemic. There is a Coxsackie virus, which is associated with all kinds of diseases. Coxsackie is a town in New York State, I believe. Did you know that there is a Paris syndrome and a London syndrome? Watch out for a future video on this sort of thing, where diseases are named after locations. It's not always a good thing, as is demonstrated by the fact that we no longer call Down syndrome by its original name. But I digress. Lyme disease can affect multiple systems, including the skin, nervous system, joints, and heart. Aha! Now we are getting warm as to why I mentioned my background in heart medicine. More on this later. Early detection is critical, as untreated Lyme disease can lead to more severe complications, often persisting for months or even years. The first documented cases of Lyme disease in the 20th century appeared in Old Lyme, Connecticut, during the mid-1970s when children began developing mysterious arthritis. At that time, no one fully understood the cause, but after extensive research, the bacterium Borrelia burgdorferi was identified as the culprit in 1981 by Willy Bergdorfer, a medical entomologist, so a doctor who studies insects and diseases caused by insects. This discovery marked a significant step in the fight against Lyme disease. However, the disease has existed for thousands of years, with some evidence suggesting that the bacterium may have been present in ancient human and animal populations. Lyme disease is now endemic in many parts of North America and Europe, primarily in temperate or colder regions. It has become particularly prevalent in areas with dense deer populations because deer serve as hosts for adult ticks. This increasing spread correlates with changes in land use, deforestation, suburban development, and global climate change, which have expanded the habitats conducive to tick survival. Lyme disease is transmitted to humans through the bite of infected black-legged ticks, commonly known as deer ticks. These ticks become infected after feeding on infected mammals such as mice or deer, that carry Borrelia bacteria in their bloodstream. Once the tick attaches to a host, it feeds on blood, and during this process, the bacteria can enter the host body through the tick's saliva. The transmission of Borrelia typically occurs after a tick has been attached for 36 to 48 hours. Not all ticks carry the bacterium, of course, but the risk of infection is higher in areas where ticks are more abundant. In North America, Ixodes scapularis, black-legged tick, is primarily responsible for transmitting Lyme disease, whereas in Europe and Asia, Ixodes ricinus, sheep tick, plays a similar role. While transmission from ticks to humans is the primary mode of infection, Lyme disease cannot be transmitted between people or through direct contact with infected animals. There have also been no documented cases of Lyme disease being transmitted through blood transfusions, though the bacterium has been detected in donated blood, prompting further research and precautionary measures. The symptoms, or what we call clinical presentation of Lyme disease, can vary widely, depending on the stage of the disease and the organ systems involved. There are 3 stages of Lyme disease: the early localized, early disseminated, and late disseminated. Early localized Lyme disease usually occurs within 3 to 30 days of a tick bite and is characterized by a distinct skin rash called erythema chronicum migrans, ECM for short. This rash typically starts as a small red spot at the site of the tick bite and expands outwards in a circular pattern, sometimes developing a bullseye appearance. The ECM rash is usually not itchy or painful, and it may be warm to the touch. It is seen in approximately 70 to 80% of infected individuals and is a hallmark of Lyme disease. In addition to the rash, early localized Lyme disease can also present with flu-like symptoms like fever, chills, headache, fatigue, muscle and joint aches, and swollen lymph nodes. If untreated, Lyme disease can progress to the early disseminated stage within days to weeks after the initial infection. At this stage, the bacterium begins to spread through the bloodstream to different parts of the body. Symptoms of early disseminated Lyme disease may include multiple ECM rashes on different areas of the body, neurological symptoms like a facial palsy, loss of muscle tone in one or both sides of the face, meningitis, inflammation of the membranes surrounding the brain and spinal cord, and nerve pain. In addition to neurological involvement, Lyme carditis, a heart inflammation, can develop, causing irregular heartbeats or palpitations. This condition can be life-threatening if not promptly treated. Now, as a pacemaker doctor, I have actually had to insert a pacemaker into a few patients who have had a slowing of their heartbeat called complete heart block. It's a devastating complication of Lyme disease to have, because the patient is now forever dependent on a pacemaker. Not very nice. Late disseminated Lyme disease occurs months to years after the initial tick bite in patients who have not received treatment or in those who have not responded adequately to earlier treatment. The most common manifestation at this stage is Lyme arthritis, which typically affects large joints like the knees or the hips. Arthritis due to Lyme disease is usually characterized by swelling, pain, and stiffness in the joints, which may come and go over time. Other complications of late-stage Lyme disease include chronic neurological symptoms such as memory loss, concentration difficulties, sleep disturbances, and in rare cases, encephalopathy, a brain dysfunction. Some patients experience post-treatment Lyme disease syndrome, PTLDS, characterized by lingering symptoms despite completing antibiotic treatment. Though the exact cause of PTLDS remains under investigation, we just don't know. The diagnosis of Lyme disease can be challenging due to its wide range of symptoms and the fact that its early symptoms often resemble those of other illnesses. I have discussed this type of problematic disease entities before. They are called mimic diseases. I discussed them in this video. A history of a tick bite and the presence of an ECM rash strongly suggests Lyme disease, and treatment can often be initiated based on these clinical findings alone. For patients without the characteristic rash, laboratory tests are used to confirm the diagnosis. The most commonly used tests include a so-called ELISA test, an enzyme-linked immunosorbent assay. This test detects antibodies against Borrelia burgdorferi. It is highly sensitive but may produce false positive results, so it is typically followed by a confirmatory test, which is known as a Western blot. This test is used to confirm positive ELISA results and provides a more specific diagnosis by detecting antibodies to various proteins of the bacterium. Laboratory testing is more reliable during the later stages of Lyme disease, as antibodies may not be present during the early stages of infection. So, how do we treat Lyme disease? Generally with antibiotics, especially when caught early, typically within 3 weeks. The choice of antibiotic, duration of treatment, and route of administration depend on the stage of the disease and the systems involved, the organ systems in the body involved. For the early localized Lyme disease, oral antibiotics like doxycycline, which is my personal first choice, or amoxicillin or cefuroxime are typically prescribed for 10 to 21 days. These antibiotics are highly effective in eradicating the infection when started early enough. For early disseminated Lyme disease, especially those with neurological or cardiac involvement, intravenous antibiotics like ceftriaxone may be necessary. The duration of treatment ranges from 14 to 28 days, depending on the severity of symptoms. Patients with late disseminated Lyme disease, especially arthritis or neurological symptoms, often require longer courses of antibiotics, sometimes up to a month. In some cases, even a second course of treatment may be necessary if symptoms persist after the first course. Antibiotic therapy generally results in good prognosis for most patients, although some individuals continue to experience lingering symptoms even after successful treatment, a condition referred to as post-treatment Lyme disease syndrome, PTLDS, which we've already come across in this video. The cause of PTLDS remains controversial, but is believed to be related to immune system dysregulation rather than ongoing infection. I have to say, for me personally, and this of course varies between doctors, I have a very simple strategy against Lyme disease. If the symptoms fit and if the patient reports having had a tick bite, and I'm usually not fussy about where the tick bite occurred, for me, if you had a tick bite sitting in your garden or out by a lake having a picnic, it doesn't really matter. Especially if you've had a bullseye rash, you are getting an antibiotic. This way, I don't need to wait 6 weeks to do an antibody test, which may or may not be positive, and spend all that time biting my nails. I have never had a patient who comes with a tick and with a textbook cut out of a deer tick to have me compare it with. Occasionally, though, I do have patients who come in with their tick that they've extracted from somewhere on their body. Can you guess which archetype of patients do this? You guessed it. It's invariably the engineers and the specialists who do this. If you have no idea what I'm talking about here, you need to watch this video ASAP. To cut a very long story short, I treat the patient with the appropriate antibiotic, reducing the risk of late onset complications like arthritis and needing a pacemaker. And like this, we end the story there. Preventing Lyme disease is key, of course, and involves minimizing exposure to ticks, particularly in areas where Lyme disease is known to be common. Key preventive measures include avoiding tick-infested areas in the first place, staying on cleared trails when hiking, and avoiding tall grass, leaf litter, and dense vegetation can all reduce the risk of encountering ticks. Wearing protective clothing, long sleeves, pants tucked into socks, or if you're European or British like I am, trousers tucked into socks. And light-colored clothing make it easier to spot ticks. Wearing thick repellents containing DEET or permethrin can also prevent additional protection. Tick checks. After spending time outdoors, individuals should perform thorough tick checks on themselves and their children and their pets, especially focusing on areas like the scalp, armpits, and groin regions. Quickly followed by prompt tick removal. If you find a tick attached to your skin, it should be removed as soon as possible using fine-tipped tweezers if you have one at home. Grasp the tick close to the skin surface and pull upward with steady, even pressure. The risk of transmission decreases significantly if the tick is removed within 24 hours. If you can't do it yourself, by all means, check into your GP or your local emergency service and they'll do it for you. In regions where Lyme disease is endemic, efforts to control tick populations and limit human exposure are essential. These measures may include deer management, reducing tick habitats, and the use of insecticides in areas frequented by humans. The increasing prevalence of Lyme disease has significant social and economic ramifications. The direct medical costs of diagnosis and treatment, as well as the indirect costs of lost productivity, can place a substantial burden on affected individuals and healthcare systems. In addition, the long-term effects of PTLDS can lead to chronic health issues and reduced quality of life for some patients. Environmental changes such as urbanization, habitat fragmentation, and shifts in wildlife populations have contributed to the spread of Lyme disease by increasing human exposure to ticks. Deer and small mammals, such as the white-footed mouse, play a critical role in the tick's life cycle, and human encroachment into their habitats has created new opportunities for tick-human interactions. Public awareness campaigns and education about tick-borne diseases are also essential for promoting prevention and early detection. Something like what I'm doing now. Collaboration between public health agencies, researchers, and communities is necessary to address the ongoing challenges posed by Lyme disease. Do you have a personal encounter with Lyme disease? Was it discovered on time? Could you therefore avoid long-term complications? Tell me all about it if you want. If, however, you want to know something I forgot to cover in this video or anything else medical, you know what to do. Ask a doc.